Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Sahar Swidan, a clinical pharmacist who has founded her own personal and educational specialty pharmacy after obtaining her Doctor of Pharmacy degree from University of Michigan and completing a 3-year biopharmaceutical research fellowship. Dr. Swidan is a board-certified advanced fellow in anti-aging and regenerative medicine and a clinical associate professor of pharmacy at the University of Michigan. She is an internationally known speaker in the areas of pain management and bioidentical hormone replacement therapy. So let's talk, Sahar, about when you first knew that you wanted to get into the sciences or medicine.
Probably from a really young age. When I was a child, I wanted to help the world and solve the world's problems since I was 3 years old. I started reading at a very young age, so I was exposed to, the issues with the world, and I always wanted to solve them. I was always a people person, and I was always a helping type person. So I think very early on, I knew I wanted to be in the healthcare professions, the medical professions, to really help people. And through life and schooling, that really solidified it more and more for me with some of the exposures. We have a lot of doctors in the family too, so it was basically you just went to med school. And funny story, so I took the MCATs. I was accepted into medical school. I was going to medical school. And then I spoke to a colleague of mine, so I started college a little early. I was 15 when I started college, and so then my funny story, my mom would always drop me off because I couldn't drive. And one of my colleagues actually was in the neighborhood, and he started just driving me because he was going to the same university. And he's like, oh, I'll just take her with me. And his wife was in the Doctor of Pharmacy program at the University of Michigan. And he's like, why do you want to go to medical school? And I'm like, I don't know, because you just do. And I really like healthcare and I want to help people. And he says, well, my wife is in this program, and why don't you talk to her? Because I think it's a really nice profession. You get to work with physicians and providers. I think there may be a little bit better work balance for families. I don't think he knew me that well yet, that, I had to conquer the world before, getting married and having kids. And I said, oh, that sounds really interesting. And, some of the different career opportunities with that degree. So I actually spoke to his wife. And then I met with the dean of the university, and I don't know, she must have drugged me. I always tease because I said, I think I was drugged, because the next thing I know is I'm going to pharmacy school and kind of a suicide swipe, and everybody's like, you don't want to go to medical school yet? And I said, let me try this. There's always time. 10 degrees later, I'm still in school, so I love school. So actually, that's how I ended up, and I love it because I think it's a really nice venue, especially for somebody like me, because I've always been a people person. I love teaching, I love educating, and I love learning myself. So I think it has offered me some different opportunities that where if I went to medical school, I may have been maybe in a certain path differently. Right. So, I always believe we all have, a chosen path and a chosen role, and that's what I needed to go. So I went to the Doctor of Pharmacy program at the university, and then I loved research and academia, and I was very surprised. I really did not think, and the first time I knew that I would love teaching, we had an assignment to present a topic, to the students and professors, and I get up and I'm just yapping away and talking like nothing. My partner that was supposed to be presenting with me, I look over and she passed out. And I'm like, okay, public speaking is not for her, I guess. And so that's really where, honestly, initially it ignited my passion. I had, I think, a gift for teaching. I loved it. And then I did a 3-year postdoctoral fellowship that really focused on research, academia, and teaching. And it's been kind of a wild ride on multiple levels, just had the pleasure of working with such great people, lots of brainiacs. I've traveled the world working on some really interesting projects. Learned from some of the best brainiacs in the world. So it's been very interesting, and that continues to honestly ignite my love, I think, for teaching and learning tons.
So you have your own pharmacy.
Mm-hmm.
and that's in Ann Arbor, Michigan.
Mm-hmm.
And so how do you balance being a mother, having your own business, traveling, speaking? How is it that you're able to balance all of this?
So my friends kept teasing me because I was really on the career track. So I always tease my friend because, when he was initially like, go to pharmacy because it's a nice work balance. You can have more flexible schedule with kids and things. And as my friend Steve always teased me, he's like, don't you have womb hungers yet? That's what he called getting pregnant. Do you have womb hungers yet? And I guess I was in the geriatric maternal club, as I always tease, because the womb hungers did not hit me until a little bit later in life. I'm very OCD, very organized, and I'm very mission driven. So I'm like, okay, I will get this degree now. I want to publish 40 articles by this age. I want to write these books by then. And then it was like, oh my God, I didn't get married yet. So I was like, okay, mission, get married. Mission, got married, check. And I'm like, a couple, 3 years later, I'm like, oops, biological clock. Mission, babies, check. 2 babies. So I always tease, love my OB-GYN friends, because if you're above 35, it's always advanced maternal age. I'm like, you guys are great for the ego up here.
How did you meet your husband?
So very interesting. So he was here. So he has a PhD in microbiology and genetics and genomics. So that's what we met. So he was actually doing his schooling in England, and he came to the University of Michigan on a summer exchange program to do research. And I'm faculty at the university, the College of Pharmacy. So at that time, I would teach a lot of pain management, neurology courses, some other pharmacy courses, ethics, things like that. So we basically met through that world at the university, and we were friends for a long time. And then finally, I'm like, oh, you like me? I like you. Yes. Okay, let's get married. Check. So mission accomplished, babies, mission accomplished. So I think with the work-life balance, so definitely I own my own business, Pharmacy Solutions in Ann Arbor, Michigan. I teach tons, as everybody knows. I am gabbing nonstop, and I love teaching. I'm also finishing up a master's in cardiometabolic and functional medicine right now, too. And I love going to school every time I finish a degree, and I always say, that's it, never again.
What's
I'm
next?
So done. Actually, I'm already looking at the executive MBA program at the university, and my husband is like, really? So I'm already looking at the next degree. I've always been fascinated, honestly, with international business and finance, too. So I honestly think we all struggle to balance work, life, home, just everything. I think the reason why I'm probably able to do it and do it fairly well, and I credit this to my dad every single minute. So I'm a colonel's daughter. I was raised by a colonel in the Army. So our life was very regimented. And as a child, you hated that, of course, because you wanted to play, you wanted to be sloppy, you wanted to just be chaotic like a typical kid. And a lot of times, really, we were not allowed that to some degree, where it was, okay, great, you come home, you're going to have lunch or dinner, early dinner, you rest, you have dinner, this is homework. This is playtime, this is bedtime, your bed has to be equal on both ends, that kind of mentality, which now I love it, because it's the only reason why I can have literally 50,000 things in the balls in the air, as my lawyers always worries about me. He's like, I've never met somebody that can have 50 balls in the air and you keep them going and keep them well. So that has, I guess, served me well in the crazy adventures that I always love. But I always just say it's just so awesome and exciting there. There's so many brainiacs, cool people to learn from. I was just talking to a couple people out there. It's just, the brain power, the cool stuff that people are teaching, and then I'm like full on, I have to learn it now. I have to research it now. And
how were you first introduced to A4M?
So, funny story. So I've known Dr. Pam Smith she met me when I was literally 20 years old, and so we've been long. And actually, so we met at speaking venues. So she came to me and she's like, oh my God, you're a great speaker. I was speaking about natural and alternative things, and I really learned that. And this probably what sparked my love for other forms of treatment. So when I was doing my research fellowship at the university, my professor fell in love with a Frenchman. So she moved to Europe, and she left me, here you go, a 20-year-old punk basically with lots of money with NIH grant to do some of the research and clinical studies. And so because of that, I traveled to Europe a lot actually to work on the studies with her. And then I had the pleasure of working, learning the German Commission E, working with them, the nutraceuticals, and there it's very different world. They're really into lifestyle, mind, body, spirit, nutraceuticals, things like that. Where here we're much more, I call it Band-Aid medicine, disease, drug. And that's how we were all really taught. Very little in lifestyle, nutrition, nutraceuticals, and things like that. And also in Europe, the vitamin and supplement industry, it's much more organized, and it's really like drugs. They're controlled like medications, and they undergo the same good manufacturing practices and things like that. So that really opened up my eye to other treatments. I was like, wow, how interesting. And I've always been the why child. That's why I drive my parents crazy, and my kids are doing that to me. And so my parents always
retribution.
laugh. They go paybacks. So I've always been the why child. So like in Europe, when I was there, I would just go to physician's office. I'm like, hi, teach me what's different about your model than compared to the American model. I went to hospitals actually and just researched them on my own to better understand how your treatments are different. I would go talk to the pharmacies there, very different, with powers of the ability to prescribe, recommend, things like that. I was like, wow, what an interesting model of treatment. So when I came here, I started really to teach about that type of medicine a lot more. So I would incorporate a regular, I would call it Band-Aid medicine. Sure, this is headaches, migraine, this is how you treat it with this. This is some other, recommendations.
You were incorporating this into your University of Michigan protocol?
Yes.
Okay.
So just didactics. I've always honestly been speaking since day one of life, if you will. So when I would speak at the national, like the American Academy of Neurology or whatever other meetings, American Society of Health System Pharmacists, Michigan Medical Society meetings, whatever, I was always on the speaking circuit. So I was like, wow, this is fascinating. I really need to teach the providers and doctors and pharmacists other ways, because they're complementary, not necessarily instead of, or at times it could be instead of medication. So, I started to really research, teach that. Was called in the principal's office a lot, as I called it in the beginning, because this was new science, new world. It was not evidence-based medicine. So why are you teaching this? And I'm like, on the contrary, there's a lot of evidence for this. Actually, in the European literature, the Italian literature, it's just it has not embodied the full force like it has in those countries. Because again, their model of care is different, treatment, modalities, all that stuff. So that's really how I became fascinated with, I call this logical and physiological medicine. So they go, what do you teach? I said, I teach logical and physiological medicine, right? Because it's really based on physiology. And when you learn physiology, logical way to treat the bodies and help it heal itself. So I've kind of coined that term on my own. I teach logical and physiological medicine. So I started to kind of do this, teach it in my teachings at the university and through my other life of teaching, publishing. I've worked with Dr. Rose, and we wrote on coenzyme Q10 and headaches and migraines, and I started kind of to trickle that into our inpatient hospital. So I would round with a pain team every day. And so in the beginning, it was like magnesium, CoQ10, riboflavin, and then some of the stuff started trickling in the literature, right, with migraines. And so to answer your initial question, that's, Pam, basically we met through this initial speaking. So it's like, oh, wow, this is fascinating. You're speaking about alternative things for treatments. And I said, oh, absolutely. And I said, hi, what do you do? And she was just really leaving her ER practice and kind of getting into this world too. And, hormone, the hormone queen herself. And then we started to do, basically a lot of speaking circuits together. We would, because she lives obviously, as you know, in Michigan too, with me. And so we were in the same health circuits, let's call it. And then, when she became more involved with A4M, and obviously I started speaking here. So I've been here since day one of life of A4M, I think, for the past 20 years now, teaching different modes and capacities for the past 20 years. So I've been here a while. Now, 20 years later, so it's so funny because I've been doing pharmacogenomics for the past 15 years on our patient. So back then that was voodoo. What are you doing? What is that? What do you mean you can learn the person's genes and pick treatments according to what they need? And I'm like, yes, that's personalized medicine. That's why we did the Human Genome Project, right? This is the whole idea, so I can personalize medicine. So, 15, 20 years ago when I was doing this, and I was giving people probiotics for their headaches, and it was like, oh my God, what is this voodoo stuff, right? But now we've come into the era of omics, I call it, right? Now it's genomics, it's proteomics, it's metallopromics, it's nutrigenomics, it's biomarkers. So finally it's awesome to see the growth and the acceptance now. Because, 20 years ago, we're psycho and crazy clinicians, right? In probiotics, oh my God, giving people bugs. Finally the gastroenterologists have accepted that 23 years later. So it's been really nice to see that growth, and I think the acceptance, and I always tell them, and I tease my colleagues, and the other side still, I go, it's okay, we're just 20 years ahead of the curve, and that's okay, you'll catch up eventually. But you can call us whatever you would like right now. This is very scientifically based. And I think that's why I love this organization. I've been here since day one, and I'm very devoted. I don't speak for anybody else except really A4M and basically medical institutions, because I'm really trying to bring this medicine, into those sectors, if you will. I think we're so scientifically based, and I think that's why we're so well accepted, and the growth here continues because it is physiological, logical, and scientifically based medicine, and it's just so nice to, when we see these physicians, how they just get reignited and their passion for medicine comes back, because they're basically burnt out. I mean, I can't tell you how many people come in and go, I need to get out, or I need to go on Prozac, literally. And I'm like everybody's Mother Teresa, so, they all call me with these things. So it's just really nice to see how this really sparks their energy again, their love for medicine, their passion for it. I mean, it's really life transforming for a lot of them. And I think that's why we as faculty, and I'll speak for me, obviously, why we're so addicted to this, if you will. It's my epinephrine junkie. I'm an epi junkie. I love teaching, performing. And it's great because, I had one physician send me, and he was actually from the Middle East. Because, as you know, we attract doctors from all over the world. And he goes, it was such a well-put statement. And he goes, God bless you, and God bless you all. He goes, you are the chosen one to take this type of nonsense medicine, make it logical, where now we can take the teaching and touch thousands of lives across the globe. And it's like, wow, what a powerful statement. And then, when people go, why do you guys do this? Because, the ROI, by the time you read all the articles, put all the slides together, the research, this is the worst investment of your time, right? Education in academia is always the worst investment of time. I call it the ROI of worst, and not, but I think we're just also addicted to that, because I think you're advancing science and knowledge. I think you're doing such a great thing for humanity. That's my biggest driver, because you teach those disciples, I call them, and they literally go and touch thousands of life around the globe and change people's lives and health. And, and I think it's so great because we just teach them additional tools, what they learned in their allopathic medicine. And sometimes they're frustrated. I'm like, you cannot throw all that education and knowledge. They go together. They're not in replacement of each other. They're complementary to each other. So do not throw the baby with the bathwater. You must do all the good stuff. You must touch thy patient. You must examine them,
Can you give an example of a physician that that practiced traditional medicine, that either had gone through an A4M fellowship or just utilized your pharmaceutical knowledge and your services within your own community, that you helped make an impact on for the way that they practice medicine?
Oh, God. All of them, honestly. Honestly, and, that may sound whatever coming out. But that's exactly what we do, right? I mean, they all, and even the skeptics, we get those all the time. And initially they're like, and I said, it's okay. You should be skeptical, and I would hope so. You should question us. You should research this knowledge. Make sure we know what the heck we're talking about. But
a doctor that writes a script and sends a script to you to fill, whether it's for hormones or whatever, do you ever call them and say, you're prescribing way too much for
yesterday.
this? Okay.
Yesterday. I mean, I'll tell you a real life example yesterday so my pharmacist spoke to this one provider because what she was ordering was crazy. And they said, Sahar, this is your level. You need to talk to her. She was ordering estradiol, 2 milligrams, and 40 milligrams of estriol, oral. So first of all, we teach all of our fellows, you never, ever, ever give estrogens orally because of the blood clotting, decreased growth hormone, and many other reasons. That is not the way to give estrogens. Second of all, it is a psychotically high dose, okay? Psychotically high dose. There's nothing in physiology, literature, science that corroborates these studies. So I called her and I said, hi, Dr. X, can you tell me why are you doing this or why this level of dosing? And she's like, well, she came to me on this. And I said, okay. And I said, she goes, but it was cream. And I said, okay. So as you know, there's 6 studies now that have shown that topical estrogens do not enhance the clotting risk. Obviously, 101 medical school, that oral estrogens can increase the clotting. So I said, first of all, they came to you on a pretty huge dose of estrogens, and you know this. Now you switch them to oral, which is much more dangerous and much more clot potential. She was like, well, they came to me. And I said, doctor, if they came to you on cyanide, would you continue to do that? Okay. And she goes, okay, point taken. But I said, first of all, we cannot fill this because this is not good medicine. This is dangerous medicine. So I'm sorry, we're not able to fill this. I appreciate the fact that somebody else did this, but now you have to do the right thing because we teach you better. You are our disciple and you know better.
This was a physician that's gone through the program? Okay.
Yeah, but sometimes they do this, and you'll hear it. I mean, I was just talking, well, they came to me on X, Y, and Z. And I always tease them because I give them the same story. I'm like, well, if they came to you on cyanide, would you propagate it and keep writing for the script? And I said, there comes a time when you cannot continue the craziness that's out there because there's definitely some renegades. It's the wild, wild west in some degrees and avenues. But I think that's why sometimes I think our guys, they get pulled, well, somebody else was doing it. I don't know what to do. I don't know what's safe to taper. But I said, it's okay. Call us. Talk to the professors. We're more than happy to help you. But you cannot continue dangerous medicine, And honestly, that happens on a daily basis. Not to put in a plug for our guys, but, I think our fellows are much better and we don't find as many things because they're properly trained. We teach them. I call it physiological and logical medicine in pros and cons of different treatments and how to better evaluate a patient because this is why it's personalized medicine. One dose or one mode or one method doesn't fit all. And sometimes I know we'll do it this way, but in real life that doesn't work. Your job is really to teach them like the business school. Let me teach you some additional tools. Here's some other things to think about. Now go build Google, go build Apple, go help this patient, right? So it's more about giving them, I think, the right tools, the right knowledge and science, and not necessarily how to cookie cutter it because this is absolutely not cookie cutter medicine. That's why patients don't want it. They don't want cookie cutter medicine. They want personalized medicine,
So you've been taking this path for the last 20 years. Have you had any regrets along the way? Is there anything that you wish you had done differently?
No regrets whatsoever. Love it, because I think I just live everything to the fullest and just so neat. And even if I do something like, okay, that was not the smartest thing, learn, move on. And
do you ever wish you went to medical school?
Honestly, and sometimes I even think about that, and many of them, they're like, it was funny actually, a doctor, this was about a year ago, she's like, I don't know what you are. And I'm like, what do you mean? And she's like, you're not a doctor, you're not a pharmacist, you're not a PhD, you're better than all of them put together. And she's like, It's just like, your talents are so different, because they're in different spectrums and stuff. And, sometimes I think of that, like, oh, I should have went to medical school. I mean, honestly, that thought crosses my mind rarely. But, and even a couple of times I'm like, Pam, do you think I should go to medical school? And her answer to me, and several of them, honestly, they're like, why? She's like, why? What would you do different? Because, your gift and passion is teaching. Who are you teaching already? And what are you teaching? So she goes, what would it really add to your life? You see patients, you help doctors, help patients all day long. So honestly, in a way, I don't regret that at all. Sometimes it has crossed my mind just because I think, not because I want to be like MD doctor, but it's because I love learning. It's it's another degree that could I learn differently or more?
But wouldn't you perceive it as potentially going backwards because of how the traditional medical schools are teaching?
Well, to be honest with you, I think it would drive me nuts. And I can tell you, and I know this for a fact that it would, because I know such different medicine now. Now, would it be, I guess, bad in a way? No, because I really still think traditional teaching is important. I'm telling you, we are amazing at helping acute care, traumas, surgeries. We still rock that like the best in the world. Chronic disease management, we're horrible at. We're literally like Ethiopia outcomes. I mean, we're number 35th in the world. So this is really where we need to make a huge impact, is chronic disease management. And this is where this type of medicine fits best, with allopathic teaching, with this. And I think if we marry the two, oh my God, then we would be the number one, again, in chronic disease management, as we are in acute trauma, surgeries and some of the other things. So regrets, no. I think I just would like to get another degree. Like, I just got an MD degree now, so because I love it. I'm doing exactly what I would have done, and honestly what I've meant to do. Even if I went to med school, I think I would just end up teaching, because that's, I think, my passion and gift.
So you would say then, if you weren't doing what you're doing, you would be teaching?
Probably. I love teaching, research, knowledge, finding. I'm actually really good in business because my family has tons of business. And as you know, in healthcare, we don't get any business experience. So we are horrible business people. I was lucky that my family has a lot of businesses, and I had an uncle. He's always my guardian angel and still is, and looks upon me every day. I know that. He just took me under his wing because I was an inquisitive child and I wanted to learn everything. Taught me business and life since I was 12 years old. And I think that's why I'm good at running business adventure. I'm very entrepreneurial in a lot of ways. Just kind of take everything on full force, learn it. Screw up, great, no problem. That's how you get better. If you don't screw up, you don't get better. And, you just learn from that and move on. And adventure number 2 and 3 and 1,000 now, probably.
So can we talk about your personal life?
Sure.
So do you have any spare time?
No. Honestly, no. And everybody's like, isn't this stressful? But honestly, because I love it all. I don't think it's stressful to me. First of all, I'm extremely lucky and privileged. I have the best family and the best husband and support system. I would never be able to do all of this. And also as a mom, as we all know, I think mom guilt always kicks in. If I didn't have good support in home and like peace of mind, I always, that's priceless. I would never be able to trot the globe like I always do, publish research, stay working late, whatever. And then I make it up on the weekend. So do I have any personal spare time? No, which is bad. So I don't recommend doing what I do. I mean, I literally work 80 hours a week. But even with that, I still find time, I am with my kids, like even sometimes I'll tease now. I'm going for the 2-hour intermission, go home at 6:37, 4 and 5. So, the 2-hour intermission, go home, be a mom, right? You're going to make lunches, dinner, baths, homework, read them bedtime stories, tuck them in, and then I'm right back at the computer till 1, 2, 3. And that's when I do either my creative work, catch up on life, writing, publishing, master's work right now, studying, being a student. And that's what I do. I sleep only about 2 to 3 hours, which is, again, not good in functional medicine. Don't do what I do, just do what I say, okay, everyone that's listening to this? So I've always been that type. I only needed really 2 to 4 hours of sleep to fully function and at full throttle, like this. So, so I think that's another reason why I'm able to accomplish more because,
Do you have any hobbies outside of medicine arena?
So used to. I think ever since Babyville, as I call it, I think because, again, I feel so guilty because I'm crazy traveling, speaking, writing, blah, blah, blah. Now every spare moment that I have, I just run and want to be with the kids, just because mom guilt kicks in. But I love reading because, again, I love learning. That's like my vibe. Love oceans. I'm all about the oceans.
You're living in the wrong place for that.
Yeah, so I think it's all about energy. Walking by water, I just think it's so therapeutic. And then I think my biggest hobby is I love people and cultures. So in the old days, I've traveled the globe, loved working with brainiacs from around the world. And then, so I was very lucky and privileged to go to places at a very young age, like Australia and China and Sydney and Japan and the Middle East and Thailand and Ethiopia and things like that. And I used to volunteer with Doctors Without Borders too, so I got really to meet some interesting people from around the world. So I think my biggest hobby is learning people and cultures, and I love that in my spare time. So what I used to do is to stay longer when I would have a gig, as I call them, whether it's speaking, learning, teaching, writing, working on a collaborative research project with some colleagues. To stay around a bit longer, and just really down in the trenches with the people and learn that. So I would say, love classical music because now I don't want to get Alzheimer's, and I hear language and music is the best. So I started now just to take piano lessons. Actually, one of my other checklists on life is I want to be a classical piano player. So
do you keep a bucket list?
Mentally, I would say, but not on paper. I'm very OCD, organized, charty type person, checklister. But it's more mental checklist. But yeah, so now. So
how long have you been playing piano?
Horrible. So I'll admit I am a college dropout. So I signed up for piano lessons in college, and it's the only course that I've dropped off and did not ace it. And then I'm like, okay, try 2, try 3. So now so I did it reverse. So one of my best friends, he's the dean of the School of Music, and they were having a piano sale. He's like, Chris, he goes, Sahar, your goal in life, so come get the piano. So I bought this beautiful grand piano, put it in the house 5 years ago, and I kept looking at it okay, really? You've got to use this beautiful instrument. So finally I signed up, and I have a teacher that comes and teaches me because I really need to get my left brain going. It's very thick and big on the right side, I know, but it's very small on the left side. So I'm doing that and learning languages because that's another great way to. So I speak 3 languages, already: English, Arabic, and Spanish. Pretty decent. So now I'm thinking of Mandarin Chinese actually now, to see. Because I hear that's really good for just, so I'm music with language with my left side, that might be good.
Have you started to see the benefits?
No, because I really want to tone my brain. Sometimes I tease, I'm I wish I was depressed.
You have a perpetual smile and a perpetual glow about you. It's infectious,
I know, because sometimes I'm it might not be bad to be depressed.
Whatever you're on, you might want to
overachieving. I hate that internal drive, right? Because it's really nobody does this to me. It's just me, Wow. It's my own internal whatever.
From the time you were a little girl, you were
pretty much, yeah. I started reading when I was 3. I was solving the world's problems. My dad was a colonel in the army. Right. I walked into his dignitary meetings and I told him how to solve Camp David problems when I was 3 years old.
Oh, they can use you in Washington right now.
So that's when my dad said, oh my God, Houston, we've got problems. And it's been like that.
Do you have a mentor? Or someone that inspires you?
So probably my biggest inspiration and my biggest guardian angel in the world, which he's in heaven now, has been my Uncle Mitch.
You refer to him?
He always... always had my back, took me under his wings from a very young age, and I know he still watches and guides me like every day and stuff. But God, so many people, like, I mean, I think my biggest inspirations, I think initially from a professional perspective, were like the Pam Smiths of the world and my two fellowship professors. So I had two of them. I had a PhD and a PharmD. So I had the best of both worlds. So I learned, I call it lab rat science, right? Benchtop research. And then I had to, that's why I think, honestly, to some degree, I'm so good, I call it translational sciences, right? Okay, this is how I teach doctors. Okay, the studies are really nice and cool, but what do I do with my patients on Monday morning? So I call it, I'm like the queen of translational sciences. I can take all this stuff because I've learned from a PhD in science and research. I did lab rats and I did rats. And then I'm like, okay, how do I transfer this knowledge to the clinician?
So they can implement this into their practice.
The prescribers, the pharmacists, the nurses. How do I translate that down to them? So they were great and very instrumental. Two very strong women, highly accomplished in their careers, pushed me to death almost. And, when you're going through it, you're just going so fast. You don't even, I'm like, I hate you people. But now it's like, wow, the skills, the role models that I had with, the Pam Smiths and those kind of people. And, and I started molding in, some of the other people, and just like, what a group, Jim LaValle, Andy Heyman, Pam Smith, those are your people you look up to and your mentors and your colleagues, how cool, right? And then personally, it's like, oh my God, like my mom, my mom and dad, of course, you always say that, but you love your dad, but, moms are moms, she's always just been my rock, my back, I would never be able to accomplish so much. Especially now with the kids, I think she's much more critical because it's so nice to have that female influence and body still at the house when I'm gone. God bless her. A lot of times she just lives with us because I live in hotels and on Delta. So she just she comes in every time I travel. She stays with my husband and, helps with the kids and stuff. So,
what's been the most rewarding part of your journey?
Oh, God, all of it. Honestly, I can't. I'm the type, even if it's something is bad, I just learn from it and move on. I think negativity is just bad for you, for humanity and for the soul, and I really think it sprouts cancer. I always tell people that. I really think negativity and bad feelings and grudges, they just sprout cancer. So I'm always been really good at just processing that and just I'm done. I don't have time or place for that. And I just move on. I think rewarding, God, just, learning, I think the aspiration to always learn more, I think be better. It's just so nice to be in the company of brainiacs. Mind you, I'm in Ann Arbor, the University of Michigan. So every time you think you got kind of smart in Ann Arbor, the dumbest person there has an MD and 7 PhDs or something. So I think I think it's always the mission, because of my circles, let's put it that way, and I choose only to be in those circles. Again, it's a self-inflicted pain, as I call it. I think the biggest reward has been always to be better, be the most that you can be. I think continue to learn, and what good energy do you bring into the universe? I'm really about that. I really believe in karma. I really believe in The Secret. I really believe it's all about the energy that you give to the universe, and it comes back to you. So I'm trying to be just a good old soul to the universe, teach as much as you can, learn as much as I can, and just be hopefully a shining light for most people in whatever I do,
So your inspiration when you're teaching, for example, this weekend, here at this module, what would you hope would be the single most important thing the single most important message that you would inspire your constituents and your students this weekend? What would you hope to leave them with?
I think all of us, with every module or every teaching, we always get up there and, our hope is, I think if we can just shift the course of one patient, that we taught them a pearl or something unique or something that they would have, I call it the aha moment, when the light bulb goes off and they go, oh, that's what I can do for that patient. And most of the time, that will turn around the life of that patient. I think then we say that was a success. I always say, and and I know we teach them a lot more than that, but I'm like, if I teach you one or two things that you can implement in your practice on Monday morning and start changing the lives of many that you see on a daily basis, that's a success. That's our inspiration always, right? Because it's one patient at a time and it's one doctor at a time. It's in one script at a time, if you will, that we change this. And that's why 20 years ago, when I first taught the modules, we had 4 doctors in the audience. That's what we had. And now it's in the thousands and thousands, at the meeting. I mean, it's just been so rewarding and inspirational to see how this is growing like wildfires and will continue to explode, because now we're finally coming into the era of personalized medicines 20 years later. But hey, better late than never. Now we're just coming into personalized medicine. So this is going to just explode more and more.
Does there exist another Sahar? Is there someone else out there that has your designations and certifications and degrees that...
I don't know about that. There's tons of Sahars, I think, from the brainiac side. There's a lot of brainiacs out there, so I'm definitely not any smarter than a lot of people out there.
Do you seek advice from anyone?
Yeah, of course. The minute you think you know it all, that's when you're going to go down. Mm-hmm. Never, ever. That's one thing. I'm always humbled by other brainiacs and people, and I never think I know it all, because the minute you know it all, you're going to be in trouble. So absolutely. I think the difference with me, it's not the brainiac. There's a lot of brainy people out there, and I work really hard to be good at what I do and be a brainiac, if you will. I'm constantly learning, studying, reading. I think it's the extras that come with Sahar that might be a little unique. I think my ability to teach, and I think the translational science, and I think to do it also in a fun format that I think keeps their attention and keeps grabbing their attention, which is good for us because I can keep their attention spans probably longer, where they can digest and learn more and more materials. And that's what I get. They tease me. They call me Evangelist. And I'm like,
you'll be seeing your show on Sunday mornings, right?
So, I think that's just, I really think every person has a gift and a mission in life. And I just think that's one of my gifts and missions. I definitely, it's the communication and the evangelical teaching that a lot of people, they tease me. They do call me Evangelist Sahar and that.
So could you try to distinguish between this more personalized form of medicine and the traditional model of medicine in your role and how you participate in that?
So I think, honestly, the difference between allopathic medicine and this medicine, I think, is very easy to distinguish. Mm-hmm. So before, how we were all taught, it's Band-Aid medicine, I call it. So symptom, drug, symptom, drug, symptom, drug. Really, that's how we were taught. You have diabetes. Now, in personalized medicine or logical and physiological medicine, we try to find the source. So, for example, why do you have diabetes? Why do you have hypertension? Okay, you have plaques now, but why? Is that cholesterol? Is that inflammation? Is that PKS9 pathway? So I think we have a lot more tools in this arena to find the source of the problem, address it, and fix it, versus band-aiding. Now, let's not kid ourselves. Sometimes we do all this really cool stuff, and we dig and we dissect and we, to the atomic level. We go down, and sometimes
you still have to prescribe.
Nothing is glaring, and I need to prescribe because my main goal is I got to control your sugar. But our way is much nicer in the sense, can I also help you with a multimodal approach versus here's your pill? Can I help you with lifestyle? Can I help you with stress reduction? Can I help you with sleep enhancement? Can I help you with supplements and vitamins, nutrition, that kind of thing. So I think we tend to be a lot multimodal versus one mode of treatment. So I think that's the largest difference between the two. And I think, again, because now it is the era of omics, we're really getting, even in traditional medicine now, the psychiatrists have really embodied this rule, which is really cool, where they do look at omic-y stuff and how can I better prescribe. Now, I don't agree with what they're prescribing at all still, but hey, we're getting there. But at least let me make a smarter choice personally versus the one pill fits all mentality, right? Because it doesn't. What will work for one person's brain is absolutely different than what will work for the other person's brain. And I've been doing pain management and neurology and migraines for 20 years also. And we always said this from day one. It's not what happens to your brain. It's whose brain it happens to, right? And we see this when we can't explain it, but that's the personal difference, literally. Somebody gets in a car crash, same car accident. This person is disabled, can't think, can't talk. And this one just walks on, I'm like, and nothing happens to their brain, right? So it's not really what happens to your body or your brain. It's whose brain it happens to. And that has to do with genetic predisposition and personalization. And that's why what is needed for one is very different than what's needed for the other. And I think that's the coolness of this, and the innovation. Because it's not, I call it cookbook recipe medicine, right? Asthma, this is how you treat asthma. Diabetes, this is your guidelines, doctors. This is how you treat that. Everybody has a cookbook, right? And you follow the cookbook. Well, in this world, we don't follow cookbooks because let me find out why, because your physiology in Y is very different than your physiology in Y. So I think that's been the coolest part, and learning physiology, all the stuff that we learned just to pass an exam, and now I'm like, oh, that's why they wanted us to learn that, now it clicks. And as far as like, how have I helped with this? So I talk to tons of doctors every day, emails, phone calls, Sahar, can I run this by you? Can you think with me? Can I send you this patient's labs? Even in the hallway now, sidebars. Hey, Sahar, I just read this or whatever. So that's honestly what I do all day. So my staff tease me. They call me the clinical AT&T operator. So that's what I do all day. I'm really talking to fellas all day via email, phone calls. I get sometimes 200 to 300 of them a day. Just running some cases by me, some clinical things, ideas, just like to think with them. And I see patients myself. So a lot of physicians also send consultations when they're stuck, as they call it. And then they just go see Sahar. So they send them to me to kind of think with them and maybe come up with other ideas and, treatment options for them.
How has all of this impacted your personal life? About how you treat yourself, your family, your children?
Oh, God. Well, first of all, I thank my lucky stars every day that I went into the healthcare industry. It is such a hard industry to navigate, and I thank my lucky stars for nothing else. And if I never touch anything or do anything professionally in this field, I know how to navigate the healthcare system, okay? I can get stuff done for my family. And very recently, my cousin was in a really bad car accident, and she literally would have lost an eye if I couldn't navigate the health system. So how have that impacted me? Absolutely. I can know how to protect my family, myself, and the loved ones much better. But so grateful for this. Like, wow, first of all, I'm so lucky because I've been teaching with these brainiacs of the world, for the past 20 years in every disease. So when somebody pops close to me, I'm like, hey, this is what I know. What do you think? Brainiac in the specialty number one, whatever. And it's been just so wonderful to build the network and the colleagues and the colleagues, because we all help each other. Like, hey, Sahar, think with me. Hey, Jim, think with me, So, and I think, and then you learn, I think because I was in Europe at such an early age, I really learned so much better. So I've been having farmers grow our meat for the past 25 years. I never buy meat from markets because I know the industry. Organic, so everybody teases me I'm an organic toxin nut job. But honestly, it even started before here because I had the European influence so early on in life. I've never bought meats from the market, foods, I do local as much as possible in the summer. I know everybody teases me, how do you have time to do this? I make my own yogurt from scratch. I do cheeses from
a cow in the backyard?
Yeah, close. I get it from, dairy farmers, non-toxin milk and, non-homogenized, minimally pasteurized. All these buzz terms. But anyways, so I think it just, it teaches you to be a smarter person. When I had the kids, everybody was teasing me, diaper. What I really would love to write my next book on is babies and the products that are out there. Oh my God. I was calling the CEOs of all these names that will leave nameless right now. What are you doing to these babies and the toxic exposure and stuff? So I'd love to do a book on that in my spare time next. So, it's knowledge. And I always say knowledge is power. Even right now with my kids, every single day they hear this.
Do they take supplements?
Knowledge is power. Knowledge is power. And that's what I teach them from right now. Absolutely. I mean, it was very funny. We went out to dinner 3 days ago. And I taught my kids at a very earlier some of this stuff. But it was so funny. This is the first time they asked this. It was hilarious. So my daughter goes, "Excuse me, ma'am. The food we just ordered," she goes, "is it organic and non-GMO?" So it was hilarious. So, they hear it. Like, I don't allow cell phones. I don't allow iPads because it's electromagnetic frequency and it's bad for brains, especially pediatric brains, and so they know. So my kids these are toxic. You don't touch them. So now they go to people and go, "Excuse me, did you know your phone is toxic? Why are you using it?" And then I'm like, so sometimes you create little monsters that way. But I think that's, wow, that the knowledge that I gained from this versus my traditional teaching and what I learned in Europe and self-taught. I just became so fascinated with this. And wow, what a gift to me and my family for nobody else. But then, obviously, you want to help humanity and spread it around. But yeah, I mean, I'm thankful every minute for just learning how to better protect my family, I call it, and learning a better system of life per se. Whether it's from food, to, the diapers. I mean, I had to order special diapers, organic, non-toxic. Their onesies were organic and everybody was teasing me about that, but they don't understand. They put fire retardants in clothes with kids and, because like, no, hopefully my kids is not going to burn, but I can guarantee you if there's a fire, that fire retardant on their clothes is not going to protect them from a fire. And you're exposing all these toxins to these young babies, yeah. So when I explain that to people, because, all the mothers think I'm nuts. I mean, they do, because I don't let my kids drink Coke. Like, oh my God, how horrible, right?
They're 4 and 5.
Right. You know what I mean? But that's like weird. Why don't you let your kids drink juice and Coke? I mean, they don't know what candy is yet. Lollipops are a decoration that go in the yard. That's what they know, seriously, from Halloween. So when we get Halloween lollipops, we go plant them in the yard. So I'm thankful every minute for just learning more, knowing more, and learning how to protect my family, better.
So when we go back to the earlier part of our conversation, when you said you just wanted to help the world and change the world, do you feel that you have succeeded in that? Or you still have so much work to do?
Oh, God. The work is never done. I mean, so, have we achieved? No. Am I working on that? Yes. And I think that's why I think I love teaching. We're performers. That's the bottom line. We're performers. But we're performing in good ways, right? I mean, some people give you good music. Some people give you good art, whatever. Some people give you good rap. We give good knowledge, right? So I do feel I'm helping the world and humanity. And I know that because I get a lot of comments like that. So it's great because like you're validating what your mission really what I want my mission to be. And I know that because, we touch so many lives every month, teaching them the better ways, if you will. And they go and touch thousands and thousands of lives. And that's how you change the world, right? I always say it's one person at a time, one script at a time, one doctor at a time. That's how you change it,
How many doctors have you taught over your career?
Oh, God. Thousands. I mean, literally, I've been speaking since day one of life, I call it.
But you're 20 years of doing this.
I mean, literally, I mean, it's thousands, if not in the tens and hundreds of thousands now. I mean, sometimes we'll do webinars. There's 400 to 500 doctors on the webinar, globally.
So I would say you've had an incredible impact on the face of medicine and where the world is going with it.
I mean, it's great, yeah. And I think that's our stage, I mean, I think we do. We reach lots of doctors, lots of lives, and, and we tease them, like, you are the disciples, right? Because they are. We teach them this better way. Now you go touch your thousandth life. And you start teaching this medicine and teaching your colleagues, right? I mean, I think that's the biggest thing. That's how I sprouted this, like my organic growth to A4M, I call it, right? It's, I'm very passionate about it, and obviously it shows because I'm very animated. But, it's getting the other guys interested, as I call it, right? It's so important to also, hey, guys, there's another way. This is great way, what you know. But we can teach you additional tools, but that, oh, my God, would rock the face of chronic disease management,
So, in closing, do you have any stories that you can share of a physician that called you with desperation about a patient, that you developed a protocol for them to go on, and that doctor called you back and said, oh my gosh, Sahar, we finally got it. This patient converted, this patient this, the patient that.
Anyways, I was just walking by the counter, and this lady was crying. So I just stopped, and I go, what's wrong? And she goes, well, I have stage 4 lung cancer, and they just told me there's nothing to do. I'm going to go home, basically, and die. And I'm like, okay. So I'm like, stop the presses. I'm like, come into my office, So I started talking to her, and then I found out she has a 9-year-old. And I'm like, okay, of course your mother heart tugs in. And I'm like, I'll be danged if I'm going to let this woman die, right? So I go into like my fight mode. And I'm like, then I start working on their brain. Because the worst thing you could do to a patient is not give them hope. The mind is such a powerful tool. And that's what I always tell my colleagues, lie to them. I swear to you, just lie to them. It's a placebo effect, right? 35% in clinical trials, So, and I hate that when they do that, because once they lose hope, and I love, if you like Dr. Oz or don't, that's your personal decision, but there's one statement he made that I think it's so profound. He goes, when I do heart surgery, I always make sure there's somebody on the other side waiting for them, because if they don't have somebody for that heart to tick for, it will not tick. That's such a powerful statement. It's so true. So, you can't tell these people I have nothing else to do, because I always tell them, until you take your last breath, there's always something to do. May not work, but there's always something to try. So I said, okay, stop crying. Get that mentality out of your head. We're going to try. Can't guarantee anything. That's life, but we're going to try. So I said, the minute you stop trying personally, the minute you will die, and I guarantee you. If there's something you tell me, and I said, cancer doesn't kill you. It's the other stuff that kills you. It's not cancer that kills people. It's usually pneumonia or a bleed or, the cachexia, right? So I said, cancer doesn't kill you. So I said, get your mind out of it. So I started on some supplements immediately, things that I know will really have been shown in clinical trials to be very helpful. So I said, here, start this. The kitchen sink, I know, but I said, right now we're going all assault all the way. I call my friend, so he does some cancer integrative stuff. He goes, Sahar, I have a 9-month waiting list. And I said, I do not care. I don't care if you're going to sleep here. You will see this woman. I said, she's got a 9-year-old son, and I'm going to be danged from Laird. I'm like, this is what I want, and you will do it. And he's like, okay, sorry. So anyways, we started tag teaming. He was doing some IPT, vitamin C. We did lipoic acid IV with the supplements and vitamins. We did some energy medicine, whatever. 5 years later, she's still here. Amazing. So, but honestly, I can tell you lots of stories like that. So I think we do impact lives on a daily basis and change them and, keep people alive. Do we keep everybody busy? No. Uncle Mitch died of cancer. I tried everything, and that killed me because, sometimes it's really sad. It's like the closest people you can't help for some reason, and you can help everybody else, My dad has a little spinal stenosis now, and he's a very active person. He's so mad at me. He's like, you fix the world and you can't fix me. I get so mad at you because so it's just almost really odd. You can help other people, but sometimes family is the hardest to help.
But I guess, would you say that keeps you inspired to keep doing more? And
oh, absolutely. 1,000%. Somebody found my YouTube video. They stopped in a pharmacy. They said, where's Sahar? And they go, well, she's not here, she's traveling. Anyways, everybody knows if it's a patient, you just give him my email and cell phone, whatever. So he calls me. It was an 11-year-old with cancer. It was his sister's daughter. Of course, that just oh my God, when I hear pediatrics, I just lose it. I can't keep it together. Because oh my God, God bless those moms. Because you just think of your kids and you're like, God bless them and give them the strength. But, she called me and she's like, I heard, I saw your YouTube video. I had blah, blah, blah. And I'm like, so overnight, I knighted him some stuff, but it was just she was just on her last breath, and I'm like, God, I wish you came earlier, because there's always. But I'm like, she's like, and I said, I don't care. It's always my attitude. You do not. She's like, everybody said stop, and I said, up to you. She's like, she's skin and bones. I said, up to you. You never stop until the last breath. That's how my attitude is, And she did pass away. It was literally. She came to me a week later. She came to me a week before she passed. So sometimes they're too far gone and you can't, but I still sent her a package overnight to her house, and because that's always my attitude. I think you just continue to try until the last breath. That's what you have to do. But I think most importantly, as clinicians, I always tell them this. Never, ever, ever tell somebody you don't know or you can't try or there's nothing else to do. There's always something else to do. And if not, you know what? Give them hope, because the placebo effect, the mind, it's the most powerful tool we have, in addition to other stuff, of course. But it's a very powerful tool. When people go, okay, I'm done, they're done. So.
Thank you so much for everything that you have taught me today and shared with us today. And
thanks for having me, as always.